How would you describe it to him?
Amazing, but scary. It definitely helps because I've had it in the past and it helps a lot.
Yeah.
My
Okay.
back feels like so much lighter.
Does it?
Mhm.
Good. Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now I know you've been experiencing headaches, migraines recently, and you have that one spot right in that mid-back that's really bothering you, correct?
Yes.
Okay. How long has the migraines been going on for?
For about a week or so, like nonstop.
Okay, not daily, constantly,
daily.
not really going away.
Yeah.
Okay, all right. So what we're gonna do, I'm gonna go through a couple ranges of motion, do some orthopedic tests. I want to kind of get a baseline, see where you're at, what's going on, and then we're gonna go ahead and go from there.
Okay.
Sound good? Okay. All right. What I'm gonna have you do now, I may have to have you remove your hat from me, please, and the glasses. I'll take that. Okay. So first off, I want you to look all the way up at the ceiling for me.
Okay.
Any pain with that?
No.
Look all the way down at the ground. Any pain with that? Okay. Bring one ear to one shoulder. Any issue there?
No.
And then to the other side. Any pain, any issues there?
Just my neck.
Okay. And if you're to look over either shoulder.
No. When kind of like right here when I turn my head this way, right here on my shoulder.
Okay, so like some pulling right in through here? Okay. All right, sit up nice and straight for me. Look forward. I'm going to push down on the top of your head. Let me know if any pain with that?
No.
Good. We're going to turn the head to the side. Push down again. Any pain with that?
No.
Good. And then to this side. Any pain with that? Good. Okay. Okay. Yeah, traps are definitely, actually really tight. Yeah. What can be happening is a lot of the times the muscles that are pulling, they can pull all the way up in that upper cervical area, and they can be causing a like a tension type headache.
Oh.
Is what can be going on. So. Okay. Yeah, things are just really tight through here. Really. Okay. Yeah, just really locked up. What I'm gonna have you do, I'm gonna have you lay face down. I just want to. We're gonna palpate the spine. We're gonna be looking for any abnormalities. We're gonna compare, symmetry from one side to the other, and then we're going to, especially because of how tight the traps are, we're gonna use the portable massage device. We're gonna relax everything first, and then we'll go ahead with the adjustment. Okay?
Okay.
Perfect. So, how we go and start everything, we're going to scan the entire body. We're going to compare, like I was saying, from the right side to the left side. So I'm going to start with palpation. Let me know if anything is tender, okay? Is anything tender in this neck here?
Yes.
Yeah? Okay. Okay, was it more on the right side or more on the left side?
The left side.
The left side, okay. Okay, definitely some tight traps through here. Okay, so we went from that cervical spine going through the thoracic spine. Okay, from the thoracic into the lumbar. Is anything painful? Okay, now that spot that was bothering you, you're saying more mid-back in here?
Yes.
Okay, is it more on the right side or more on the left?
Let's say the right.
You'd say on here? Okay, is it right here or is it up?
No, it's more up.
It's a little up? More in here?
Yeah.
Okay, so right about there? Okay, alright, so a little bit of right-sided pain in that mid-back, right in that middle thoracic spine. So we'll make sure and get that adjusted as well. So from the thoracic spine, we're going to go into the lumbar. Any issues in the lumbar spine? Any pain over that right SI joint? Directly over the sacrum?
Yes.
Okay. And the left side? Okay. So we're going to come all the way down here and we are going to check out the leg length. Okay. So she's pulling short on that left side here. We're going to scan up the body. Actually, everything's looking pretty level when scanning up, which is a good thing. And here, though, on the right side of that rib cage over here. I'm seeing a little bit high muscles on this side compared to the left. So let's go ahead. What I'm going to do first is we're going to do the massage device. Just get everything relaxed, okay? There we go. So now after we helped relax some of the muscles, we're going to start with the adjustment. Now I always like to start up here in that cervical thoracic area. And we're going to start on that left side here. So we're going to do that adjustment. We're going to do a T2 on the left side here. There we go. Okay, we're going to drop down T3 on the right. Perfect. Perfect. I know you felt that. Yeah, had a lot of movement in here. Got to take the pressure off the nerves, which is a very good thing. Okay, so I'm going to have you take a deep breath in and exhale all the way out for me. Good. Okay, we're going to drop down a little bit. One more time, deep breath in and exhale out. Perfect.
Oh, gosh.
Okay. So now we've done that cervical thoracic joint, that T2 and T3. We did the mid-thoracic adjustment. I want to come back down here, check the leg length. So now if you guys remember, she was originally short on the left. Now she's pulling short on the right side. So we're going to come over to here. I want to first check the sacrum. So I'm going to stabilize on the sacrum. I want you to raise this leg up as high as you can for me. Any pain, tenderness, tightness with that? Yeah. Okay, relax that side. Raise this side for me. Any pain, tenderness, tightness with that? Okay, good. So what that's telling me is sacrum is good. It's nice and aligned directly in the center. So what I'm going to have you do is I'm going to have you lay on your side and face me. Good. And I'm going to bend this top leg. There we go, just like that. Perfect. And I'm going to have you flip. So I am going to bend that knee just like that. Perfect.
Oh my gosh.
Alright, lay flat on your back for me. There we go. Okay, so we're still short on the leg length. You can clearly see that right side is still short here. So what we're going to do, we're going to do a leg pull. Now you may feel that in your ankle and your knee going all the way up to your hip. Good? That one I felt even release right there. Alright, I'm going to have you stand up for me. And stand in front of the table. Yep. Couple steps up. I need to get right behind you. Perfect, right there. Bring your arms out by your side.
Okay.
So I am going to come up and over. I want you to put your hands over mine.
Okay.
Good. And I'm going to have you lean back. Squeeze your elbows together. Squeeze them, squeeze them, squeeze them.
Oh my gosh. Ooh, that was nice.
And that just opened. You felt that one, right? Yeah, that was a ton of movement. I think everybody heard that at home after that one. Jeez. All right. What I'm gonna do, I want to make sure that I cleared out that one spot in the mid back. So I'm gonna do a supine or a anterior thoracic adjustment. So I'm gonna have you just cross your arm like that and like this. I'm gonna have you take a deep breath in and exhale out. Good. So that was already cleared out, which is a good thing. So now what we're gonna do, we are gonna do the ystrap today. Now this is that manual decompression, so we want to make sure and just take all the pressure off, all the nerve roots going down.
Always
Okay.
makes me so nervous.
All right, can I have you pull your hair through for me?
Sure.
Thank you. Good, good. All righty. So then this is where I come up at the top of the table in that y-axis, and we're just going to distract.
Oh my.
Perfect. And relax, relax. Just hang out there for a moment. That gets a ton of movement, and it's almost like a shock to the system, like right away. I know, it's a different one. I know you've had it before, and it's like, you know when it's coming, so it's like, oh my gosh, but all right, I'm gonna have you sit on up. Now, a lot of people, a lot of viewers out there have never experienced that ystrap adjustment. How would you describe it to them?
Amazing, but scary. But it definitely helps because I've had it in the past and it helps a lot.
Yeah, it's almost like that initial pull.
Yeah.
Because I know it's the same
It brings
thing.
like a shock
Yeah.
to your body.
Yeah, it does. It's like a, it's the initial pull. It is like a shock, and you're like, oh my gosh, what is going on? And then after you lay there for a minute, you're like, oh, wow, okay. Like you can start to like really feel that let up. No, that is a good thing, but perfect. Alrighty. Now what I want you to do, I want you to look up, look down, kind of look around, move your arms around. How are things feeling?
Really good.
You notice a difference from?
Yeah, I do.
Okay.
My back feels like so much lighter.
Does it?
Mm-hmm.
Good. Good, yeah, we got a ton of
Yeah,
movement.
my shoulders.
Yeah, so that ton of movement would take a lot of pressure off the nerves, allow the body to function and heal, you know, as God intended. So that is the whole point of a chiropractic adjustment, is, you know, relieving and removing that interference. Perfect. Another happy customer here. If anyone is ever looking to schedule an appointment, you can go right to the website, drjosephcipriano.com. From there, leave me a message. In about 1 to 2 days, roughly, it takes. I should get back to you, and I would love to get you in here. Have a good one, everybody.